All right, well, and I'm already getting my prescription.
Yes,
anytime. Welcome back to the broadcast. We started by pulling a recap of what we learned about hormones last week, but now we are in that phase of pregnancy. We've looked at what happens, of course, in the level of hospital, obstetric clinic, where I get to learn that actually it's the same as antenatal clinic, and what happens in terms of the first trimester when a woman has already it's been declared that she's pregnant, and so the key things that she needs to know, especially at this point where they go to this particular clinics, really, really important stage of pregnancy, as Dr. would put it. And now we have gotten to that phase where we understand that there's formation of the babies, the baby or babies, depending on how many, and what you need to eat, what needs to be done, what are some of the medicines that you're supposed to get, and of course, to note, it has to be prescribed by the doctor. And so we are at that level where the formation of the body is done. But before we took a break, I asked this, Dr. How different is it for twins?
What goes on is that what formed the twins? That is the first question to ask oneself. There are different types of twins. Sometimes it is a genetic. You find in a certain family, they are prone or they are predisposed to getting twins genetically. And they could be fraternal, or they could be identical or non-identical. When they are non-identical, it's completely different. They could be two boys, but they don't look alike at all. That means 23 chromosomes went to this one, and another set of 23 went to the other one. That is when they are non-identical. When they are identical, quite often it's after fertilization. When we talked about a big word, blastocyst,
yes,
it can split into two. If it splits into two, then they will be identical. And usually, the identical twins will be identical. One may look slightly older, or may come first. And we say this one is older than to this one. But essentially, they have all the genetic material that is similar. But, and this is very important, when you are forming a human being, and this I think it is supernatural. You find there are certain traits in the genetic makeup. I'll give an example. You see the fingerprint, even of twins,
they don't look alike.
They are not identical at all, even of twins. And we are approximately 8 billion people on Earth. And even for identical twins, none of them have exactly the same genetic connotations as the other. Of course, with fraternal, with this non-identical, they are two different human beings. With the identical twins, they are very, very close, but not absolute, because of the formation, the very formation of the fetus, the first few hours of formation of the blastocyst and the development of the organs is completely different. Because after all, oftenly they may not even share one and the same umbilical cord and the placenta. So you see, they are two different. It's like you are sitting at table with your sister, but the amount of food and the style and the taste will be completely different. How much one eats, how much one enjoys, how much one craves are all different. So where have we reached? We had reached a stage where
now the formation is done.
The formation has been done, is now the growth part, or the growth stage. That is what we call, from 90 days onwards, is the second trimester of pregnancy. In the second trimester of pregnancy, many things can happen. One, it is the time when now there is quick development of the of neurons or nerves and gray matter and white matter of the brain. It's very important for me to mention at this stage that nutrition plays a very big role.
Okay.
Nutrition, what does the woman eat? Africans who are very good at identifying the foods, they would give this person foods then unknown to them but with omega-3 fish. They will give this person, they know now so and so is now pregnant.
6, 7 there becomes 9.
Now this woman, when she delivers, because it will be labor and then there will be probably to put it in a layman's language, the uprooting of the placenta.
Yeah.
Okay? And there will be bleeding, probably another kilo. So we are talking about more than 10 kilos.
Wow.
And the woman is losing this in 1 day. So you can see the preparation for delivery, the preparation for development of the baby must be very careful. And the only way to go about it is through nutrition and proper follow-up and visit. If you are pregnant, please don't fail to visit the antenatal clinic. And you people in the antenatal clinic, make sure you take all the necessary parameters and more. Take the weight, take the height, take the history, check whether she has had a previous miscarriage, check the size of the uterus, check the cervix, check diseases, urinary tract infections, check the sexually transmitted infections. And I say the men, be very careful with your pregnant wives. We are not saying don't go and indulge in sexual intercourse. We are only saying don't bring bacteria. This is not the time to go and see your Monica girlfriend, because you'll pick things from Monica and bring to your wife. And because she has a lot of minerals and vitamins and proteins and everything, and you are bringing this to a pregnant woman with a very, very nice V, external genitalia and internal genitalia. She can pick infections like this. Let me mention one particular infection, Candida. Yeah. Most of the most women obviously have Candida as a normal fauna, a normal flora in their private parts. But it increases even more because this woman is very fertile inside udongo. Ni kama mahali umepanda, where you have planted your sorghum, where you have planted your maize, where you have planted your beans, is very rich. And because it's very rich, any slight inoculum of bacteria or fungi hits her very hard. At this point,
or maybe how do you know that you're prone to miscarriage or miscarrying? How do you know that you're prone to, dangers of pregnancy? Are you able to detect at this early stage and say, you know what, I can identify a problem that could lead to a miscarriage?
Absolutely. Good question. Because the visits, that's why I said they should do all the tests, all the gynecological and obstetric tests and more. What I mean is, are you taking the weight? Are you taking the height, BMI? Are you checking for blood sugar? Are you checking for blood pressure? Are you checking for these infections that we've mentioned repeatedly? Now, are you also checking in the ultrasound scan? You must also check the cervix. Is it opening? Is it healthy? Is it long enough? Where is the fetus implanted vis-a-vis the cervix? Where is the implantation? Because if the implantation, the uterus is a huge chondo, is a huge bag, and it can be, the baby can be at the top, the fundal, It can be on the side. It can be low laying near the cervix. And as the baby grows, and if the placenta is down, and the baby has at the second trimester, the baby is playing now vigorously. It was playing all through, but it's becoming more active in the second trimester. If the placenta is low lying, if it is planted below, then we may wish that the lady gets admitted and goes through what we call bed rest. Sometimes, if we noticed any bleeding or spotting, we immediately ask ourselves, is the baby in the uterus, or is it in the fallopian tube? Is it an ectopic pregnancy? Then the ultrasound scan, that what we mentioned, the first ultrasound scan will tell us where is the baby implanted. Now, if is the cervix closed? The cervix is a tube. It's about 6 to 8 inches, depends on every woman. It's just like, you cannot tell by seeing my face, you cannot tell how big my tummy is, how big my legs are. So it's not obvious that, and it's not that every woman has the same size of cervix. So we study the cervix and whether it is closed or not, and how steady it is. Some people have weaknesses, Linda. You find some people have what we call incompetent cervix. That means just like some people, like Linda here, has a very big weakness of smiling. She likes smiling. So some people have cervix that that smile a lot.
Okay.
When the cervix smiles, it can smile because you had a nice date or a sexual intercourse with your husband.
Okay.
And if it smiles and opens wider than kawaida, then there is likelihood of a miscarriage. So we must know the possibilities of miscarriages. If the baby that is developing in the woman, the fetus, if you want, if the baby is grossly malformed, mguu hakuna, ama ni mshort, mkono hakuna, saa zingine the baby has developed a problem, internal problem of the heart or the lung. There are some babies whose heart, the 4 chambers and the valves that are involved have a problem. Then I think God does not like disabled people. It miscarries.
Okay.
If the baby, for example, if there is no sufficient amnion, maji, hiyo maji ya kuogelea, if there isn't sufficient amniotic fluid, huyo mtoto atatoka. If the mother is not feeding properly, we talked about diet as a principle, and in the clinic they will be taught what to eat and when to eat, and how to avoid certain foods that could bring problems. Then they test all these things, because if there was any mismatch or any problem, including sometimes anemia, if for some reason the woman doesn't have sufficient of blood, the baby will automatically
not have.
That's why I say
anemic.
Yeah, if somebody is anemic, we check the HB, the hemoglobin level of your wife, and you'll feel the baby kicking. Just like you see babies in the field. Some are somersaulting, some are running, some are sitting kiwete, some are sitting, standing, some are sleeping on their back. The same, the babies. By the way, from very early ages of about 2 months, the baby feels and hears, even in the womb. So this baby is very busy, and the umbilical cord is a cord.
Okay.
Is a rope. So when it is somersaulting, when it is playing, it can easily, it's possible that the baby can have the cord around the neck.
Okay.
And this should be caught on regular ultrasound scans. And the mother is also advised, any change in your body, pain, you feeling like the baby is no longer playing as vigorously as it was, report immediately. Come and tell us, my baby is not playing as much as it used to. It's just like a teacher, a PE teacher, or any teacher in a primary school. When they should be observant, they must see which baby is not doing PE, physical education, properly. The mother should do that one and report immediately so that we may check whether there is something wrong with them. We have had babies, call them fetuses, that even die, pass on in the womb, and some who are born when they are we call them stillbirths.
Okay. Yeah.
So it's very important for this mother to be as regular as possible. I'm stressing this to you, young ladies of childbearing age. You must be very regular with your antenatal clinic. And you people in the antenatal clinic, hold sufficient classes. Teach them in groups, group work, and teach them individually how to feel the baby and how to report. And you also, there is always a book, a standard book, a United Nations WHO book, which they are given, where you are supposed to report. Report also the husband and the character of the husband. Report his blood group and his RH factor. Report the history of the mother from the days when she started the menses to report everything. Okay. Let that book be full. Report blood pressure, report blood sugar, report the weight, the height, all the other parameters. Report, because this is a very delicate stage. We have finished with the and did I say something? Did I say that it is in phase 2, is in trimester 2, that we also know, if you ask where you go for your ultrasound scan, is it a baby boy or a baby girl? You'll be told.
You'll be told. All right, well.
And some sonographers, some radiographers, some radiologists, they refuse. No, it is the right. Somebody's right to know. Some women say, what God will give me, I'll accept. I don't want to know. Okay. This one who wants to know, why do you refuse? Tell him. After the 4th, 5th month, around there, you'll know it will have identified itself as a baby boy or a baby girl.
Sometimes it hides, I'm told. It hides as we close.
Yes.
Sometimes it's hard to see.
It's sometimes difficult to know whether it's a boy or a girl, but repeated and I'm repeating that ultrasound scans do not repeat. They do not spoil or bring madhara. There is nothing wrong
in doing as many
as possible. The heart of the baby is also very important. I must stress that one, that we keep on checking the heartbeat. Now, we have gone through formation of the sexual organs. We've gone through formation of the brain. Now the baby is as heavy as probably 2 kilos.
You don't want us to record this to do this another time?
If you want us to stop there and we now do the 3rd trimester, it is not a long story because it is the maturation and then labor.
Let me tell you this. Yes, next time.
Next time we'll tell you why the prolactin levels. We'll tell you why the oxytocin levels. We'll tell you the same thing we did 2 weeks ago about hormones. We shall go back to the hormones.
Thank you. And it's always good to keep them guessing and waiting. That way they will tune in without doubt. That's the secret.
So we have kept big stories about the 3rd trimester and the childbirth.
Thank you so much, Dr.
Always my pleasure.
Always Linda. A pleasure too. And we hope that you will tune in next time so that we get to learn more on what plays out at the 3rd trimester. And we're also just walking into the journey of now the baby is here. What next? What are some of the care procedures that one is supposed to do?
Last word.
07.
Where are you, Mr. Husband?
Oh, you have to be actively.
Mr. Boyfriend.
Thank you.
Are you going through this journey with her? Because without you, the cake will not be baked properly.
Thank you.
Thank you very much. If you want to get a little bit more privately, or sometimes somebody doesn't want to go on a camera or to be known, you write an SMS 0722 534444. Telephone calls I discourage, because you cannot be doing this type of a job like now. I see there are more than 120 telephone calls as I was talking. I will not pick them. So don't get a habit of calling doctors. SMS them instead. 0722 534444. Asanteni sana.
How interesting the show can get at a point where we're just about to finish. We get to see you next time. It was good having you. My name is Linda Alela. Dr. Ignatius, asante sana.
Asante.
We'll see you again another time. All right.
Thank you very much.
Bye-bye.
Viewers.